Good morning, everyone. Why do we need individual counseling for an holistic approach? Well, that's the question we're going to discuss with Maya Petrova. Maya Petrova is a certified holistic coach who uses an integrative approach of functional medicine and Chinese medicine in her practice. I am Amita from NourishDoc, a global platform for natural and holistic therapies. I'd like to introduce all of you to Maya Petrova, who's joining us live from London now. Welcome, Maya.
Thank you very much. Nice to speak to you, and hello to everyone who is listening and joining us tonight as well.
Great, great. So let's talk about, I was reading that you combine Chinese medicine and functional medicine. So can you describe us the process a little bit?
Yes, of course. The reason why I combine these approaches is because I believe the body, the mind, and the soul, they're all connected. So oftentimes a disease in the body is just the body not being at ease, and the body is not being at ease about a particular emotion, for example, maybe a choice that we are making currently in our life, or maybe something that is just not working, a relationship, or maybe even a belief that we have. And I've seen it many times in my practice that when the body starts manifesting these physical symptoms or the physical illness, sometimes it is because the body is trying to draw our attention to something internal. It's just the body's way to help us pay attention to the way we're living our life. And that is why I started using Chinese medicine in my practice as a way to look for the deeper meaning behind the issues my clients were facing. And as probably many of you know, Chinese medicine is a great way to examine the body, examine the energies of the body, because Chinese medicine sees the body as a combination of male and female energies. We have the yin and the yang. And this approach of Chinese medicine is what helps me see what's out of balance in the body, which energy is out of balance, and to help us identify what's going on. Maybe we're not giving ourselves enough time for reflection, enough me time. Maybe we're not communicating with our true self, with our inner voice, higher self, intuition. Maybe the body is sending some sort of signs and we're just not hearing these signs. And then the body creates a symptom or creates a disease, something physical, as a louder message for us to pay attention and find out what's going on in our life. And this is why I use Chinese medicine. For example, Chinese medicine helps us see the emotions behind the organs, or the different Chinese meridians can help see which energies in the body are out of balance. Maybe a woman is using too much of her masculine energy, or vice versa. A man hasn't tapped into his intuition, his female energy. So this is the sort of more holistic approach. I usually start almost every client I start seeing with a more analytical approach. I use the allopathic approach to begin with, so I can find out what's the person's health history, their current health challenges, what they want to achieve in the future. Then, depending on the situation, I might prescribe additional blood work, hormonal testing, or an assessment of the client's gut health. And then, while we're waiting for the results of all these tests to come, and of course, depending on the readiness of the client, I might make them aware of these energetic imbalances that Chinese medicine is giving me. Or the imbalances that are coming as a result of their symptoms, or vice versa. Sometimes the emotional issues of the client are actually the drivers of the physical symptoms. And then if that's what happens here, if it's appropriate for the client, then we might use NLP, we might use coaching techniques, even astrology and human design. These are some really great systems that I found very insightful for my clients, even for myself. So it just depends. I've been lucky enough to have seen many different approaches to health, and having all these tools help me personalize my approach. So overall, it just depends on the person, where the client is on his or her journey, what I'm guided to do as a practitioner for this particular client, what feels right for me, and of course, the readiness of the client, to what they're ready to work on right now. So to be honest with you, the reason why I use all these different approaches is because I truly believe true well-being is a process. It's a journey, and this journey is filled with ups and downs, with many adventures, with many discoveries about oneself, and we're all at different stages on that journey. So with my clients, I see myself as someone's well-being guide on that journey. So as a guide, I might be able to take you to the end of your journey, or maybe I'll just pull you in a different direction so I can help you get on the right path for you, or maybe help you meet someone who is right for you, or maybe do the things that are right for you. Or maybe I'll just be the person who can point you to the right direction or introduce you to someone else who can help you. It just all depends. So for me, it's all very, very personalized.
No, no, that I think that makes complete sense. And earlier, nobody used to pay attention to the emotional issues and correlation with the physical. So, I mean, I'm talking like few years back, and we would all be in the habit of popping a pill. So, to your point, balance of mind, body, and soul is very important. And so, let's just talk about what's your prescription on this particular subject.
Yes. So for me, the prescription, it's different for everyone, but at the core of the prescription, it all starts with self-love, self-knowledge, and self-acceptance. And the reason why I believe these ingredients are at the core of my prescription, are at the core of the balance of mind, body, and soul, is because what I see today is this huge challenge of people facing this avalanche of information and health experts everywhere. Um, and there's just so much one can do at the moment to improve, their health. And oftentimes people just feel worse, and they don't know what to do. They don't know what to choose because there's just so much information out there. For example, at the moment, meditation is a huge thing. And everyone is thinking that must be the thing. That must be the holy grail. Then we have superfoods. Then we have the CBD oil, the keto diet, fasting. We have the affirmation tools, manifestation, all these different techniques that people can use to improve their well-being. And for me, from all my experience throughout the years, all these are just paths leading to the same destination. And the destination is wellness and self-love. So then the question is, which one do we choose? Which is the path we choose? So here, I think it's important to remember as well that we're all programmed from birth to be in a certain way, to think in a certain way, to behave with different beliefs and values. But these beliefs and values, they may not be ours at all. Or maybe these beliefs and values resonate with us at the moment, but actually they're not correct for us. Maybe they're not for the highest good at all. So for me, it's that every person is here on earth to leave their own energy imprint. We all have a purpose in our life. And only by knowing yourself, you can fulfill your true potential on earth. At least this is what motivates me. This is what's most important for me, to truly fulfill my potential, to truly fulfill the thing that I'm here to do. And it's not just work related. So we must remember here that we're all energy. So we're energy beings. And on an energy level, if we're not doing or thinking or believing what's correct for us, this is when it's most likely that the disease will strike. and various health issues will manifest all these imbalances in our life, in our psyche, in the way we're thinking and behaving. And I'm speaking from very personal experience here, because this is the way it's been for me throughout the years. There was a point in my life where I found myself searching for that special formula that would give me happiness, mind, body, and soul balance. And that one thing which would be the answer. So I traveled a lot. I spent a couple of months in Thailand. I was alone. I meditated. I did all these courses, worked on myself as others told me to do. But still, my life wasn't particularly improving. It wasn't like, the miracles we read about in the books. So then I realized that what works for one person may not work for another. And here I can tell you that there are certain things that work for me, and they work for me at this point in my life. But we as human beings, we are forever changing. We're all work in progress. So my current formula might change in the future, but what should always be the same, it's the core of this formula. And that's what I said at the beginning. Self-love, self-compassion, being able to communicate with your true self, knowing your truth. Other people call it intuition, your gut instinct. For me, that's my inner higher self. So find your truth. Maybe some people find it through traveling, meditation. You just have to find it for yourself. For me personally, this was the human design system, because at the moment I find this is the most personalized way a person can learn about themselves from something in the external environment. But it just depends. I was lucky enough afterwards, after I discovered the system, to find the right teachers, the right coaches around me to ask me the right questions. So then you can become that coach for yourself. You can become your own teacher. And yes, healthy eating is important. Exercising, sleeping well, eating good quality food. These are all very, very important. But I believe without knowing and loving yourself, you just can't have that long-term sustainable well-being. You can't have the balance of mind, body, and soul. So yes, improve your diet, improve your lifestyle. These are all great ways to start with. But it's just that. It's just start. There's a lot more to wellness afterwards.
So I think we've all heard about the stress and how it can add to the extra weight.
Mm-hmm.
So let's talk a little bit about, how to balance stress, or if there is any correlation. What's your advice on that?
Yes, stress is the modern pandemic. We can call it that.
Yeah.
It's not COVID. It's stress. Here, what we need to understand is that stress can be in different forms. Stress can be emotional, nutritional, chemical, psychological, hormonal stress. And of course, here we're talking about excess weight. So numerous studies have shown that when you lower your stress levels, when you manage your cortisol levels, you can really reduce fat levels in the body, as well as lower your blood pressure, improve insulin sensitivity, balance your blood sugar, control appetite, and therefore reducing your risk of developing any sort of disease. As I said at the beginning, there are many forms of stress, and it's just impossible to avoid them all. So here, it's important to identify the forms of stress that you can control in your life, and then take charge, take responsibility, make the changes, and of course, work on the diet and lifestyle modifications in order to support and reduce that stress load on the system. So then here, I can just give you some of my best advice on the different techniques, different ways that you can start reducing your stress load. You can see on the next slide as well, if we move on to it, the different ways we can really help our body manage stress. For me, Managing your time is very important. So, of course, planning your meals, planning your day so you don't stress about the different tasks you have to do. So, here, when you know yourself, when you know your limits, you can actually manage your time better. Very important is gratitude. So when you're able to be present and grateful for the things you have in your life, you can be more positive rather than focusing on what's wrong. Focus on what's working, because we are work in progress. So always remember that it's not perfection, it's progress. And of course, here we can reframe the situation. So if, let's say, you are having an argument with someone, see it from a different perspective, from a third person perspective, or maybe if something's not working in your life right now, see the bigger picture, how the problem, the challenge is helping your future, improving you to get to that goal you want to achieve. So be realistic, rather than, as we know with many of these new age techniques, you can sometimes become too positive. So it's about being realistic. When you know your boundaries, when you know your limits, you can be realistic and not be a perfectionist. And here we can practice acceptance. So it's not just about accepting yourself, accepting the other person for who they are. So if you're in a love relationship, rather than trying to change the person, accept them for who they are and love them for who they are. And then they can change because they want to change, not because you want them to change. And in this regard, of course, cultivate empathy. Empathy is being compassionate towards yourself, your challenges, and towards others. Understand their perspective, as we often say, put yourself in the other person's shoes. So these are sort of suggestions that can help you manage your relationships and your interactions with others. But then we have your time, how you manage your internal world. And here, for me, it's very important. I always tell my clients, prioritize me time. So me time is time you spend doing things that bring you joy, bring you happiness. It doesn't matter what it is. It's not supposed to be something to improve your life. It's supposed to be something which brings you joy and inner peace. So simple things like reading, walking in nature, playing with your pet, hang out with friends, listen to music, watch TV series which are positive, hopeful, that make you happy. Of course, learn to say no. I see it oftentimes with my female clients. They don't know their boundaries. They don't know when to say yes, when to say no. So again, when you know yourself and love yourself, you know when enough is enough and you can say no. And of course, avoid people who stress you out, the so-called toxic relationships. And especially nowadays, turn off the news because there's just so much fear going on. So yeah, I would definitely add that as well to the list. Then
There's
of
a long
course,
list here too.
yes. And, oftentimes because of what we see on the news, because of our upbringing, our limiting beliefs, the things I mentioned at the beginning, the way we've been programmed to be, we just get into these arguments that are pointless. So give up pointless arguments, very important to have this inner awareness of the present moment when it's just no way of being in that conflict anymore, maybe revisit the issue later. Um, there are many things in life we cannot control, but we can control our to-do list. So, be more organized with your day, with the things you're doing. And then, of course, we have to mention the healthy lifestyle, the things we can do with our diet. So here, for me, number one is to balance out the blood sugar, your blood sugar, eat every 3 to 4 hours. Very important to have meals that have the right amount of carbs, fat, and protein for you, for your metabolic type, especially for women. The keto diet is not for everyone. Fasting is not for everyone. So balancing your blood sugar, especially under stress, is very important. I am a big fan of food-based supplements to support the body, especially during stress. And here, of course, to avoid sweets, sugar, processed food, sweetened beverages. And when you do all these things, you're also taking responsibility for yourself and for your life, which is again part of my tips. When you take responsibility, you don't let other people determine your values and manage your life, because you are in charge of your life. Then moving to exercise, of course, have the regular exercise daily. You don't have to overtrain and go to the gym every day. The body needs as much as just 30 minutes a day to just get the body pumping, get the lymph system moving, especially when you combine it with nature, even better. Sleep, for me, that's just almost like number one for everything, because good quality sleep will help you manage your stress levels better. The hormones you need for stress management will be able to get produced with good quality sleep, ideally at 10 o'clock in the evening, or at least before midnight. Sun exposure, as I said earlier, me time to have fun, enjoying your life. And of course, I think if we move to the next slide, we'll see the usual cases I have in my practice. And sort of to summarize, the previous question with stress levels, you have to pick one or just a few practices that can help you. As you've seen on the previous slides, there are many things you can do, many things you're going to read about on the internet, but they don't work for everyone. So pick one, pick a few that work for you, and just stay consistent with them.
Okay. So I think you talked about the imbalance, and most of your patients have imbalance issues, whether they're hormonals or even the gut health, and they're all interconnected, right, with the stress, with all the lifestyle that we're leading. So how do you uncover the problems and the imbalances?
Yes, that's true. Most of my clients have adrenal fatigue, especially females. I see lots of females with hormonal imbalances, polycystic ovarian syndrome, women having issues conceiving. So I work with lots of women trying to get pregnant, and of course, good health issues. That's one of my specialty, dealing with parasites, candida, leaky gut, food intolerances. So depending on the case, I will always start with taking the patient's health history. And then whenever it's necessary, we're going to do appropriate testing. I work with some of the best labs in the world for parasites testing, checking for leaky gut. So we're gonna do all the necessary assessment. I use hormonal assessment as well via saliva or urine testing. It just depends on the person. So it's all very specific, and I have my due diligence to do the right testing for everyone when it's appropriate. In many cases, I use DNA testing, especially when we have female hormonal imbalances or women trying to conceive. DNA is very important. I mean, for me, DNA testing is perfect for everyone, because when you know your genes and the things that can turn them on in the environment, you can take better care of yourself. You know your weaknesses and what you can do to manage these weaknesses. So for me, DNA testing is just for everyone, but again, it depends on the client. And then, as I said at the beginning, depending on the readiness of the client, depending on the case, we can move to the non-traditional methods like Chinese medicine, NLP, human design, or I can just refer the client to someone else. I've got a great network of other therapists. Just depends on the person. So for me, it's all very personalized. I like to work with others, and it's all about the true well-being of the client in the end of the day.
That's great. I think that's amazing work that you're doing, that how you're combining the human element with the scientific testing and bringing it all together and making it personalized, prevention, healthcare for that matter. I think that's really, I'm not an expert, I'm not a health professional, but having interviewed so many health professionals, I think that's the right thing to do, making it personalized based on the scientific as well as the human element. So that's really great what you're trying to do. Thank you so much for being with us today and educating us about how we all should consider the individual approach, for our health. Anything else you'd like to add, Maya, before I wrap up?
Well, thank you very much for your time. Thank you everyone who joined or who will be joining later. I hope I've helped you. And of course, if anyone has any questions, feel free to reach out. Everyone is different. I've been there. I've had
Yeah.
my own health issues. I've been on the journey, and yeah, I'll be happy to help.
Thank you. And we are having Maya come back for a more detailed presentation in a couple of weeks or so. Please help us share these sessions. These sessions are meant to show efficacy of natural therapies. These are educational sessions. Please help us share these sessions to increase the awareness of natural health. Thank you so much. Signing off now. This is Amita. Bye now.